And we are recording. So welcome everybody. It's that time of the year again where the PIC Corporation benefits are up for renewal, and the decision has been made to move away from AmeriHealth to Aetna starting December 1st. On the call with us, I have Craig DeRosa, who's the Aetna account executive, who's going to walk you through the benefits in advance of December 1st, so you know what the benefits are going to be and some of the extra benefits that you can get with moving to Aetna. Also on the call today with us is Joe Genova. Joe Genova is your account manager that works in my office. I wanted Joe to be on the meeting. Obviously, you could put a name to the face or face to the name. With that being said, I'm going to turn it over to Craig to go over the benefits of the Aetna plan that's going to be effective December 1st. Take it over, Craig.
Thank you, Ray. Good afternoon, everyone. Again, my name is Craig DeRosa. I am the sales exec. I've been working with Ray for a number of years, so rest assured you folks are in good hands. I like to do these meetings, obviously, informally. So stop me at any point, ask questions. If I say something that doesn't resonate, please let me know. If anyone has any questions that are personal in nature, please hold those to the side. We can get them answered maybe via email or a side note phone call. So again, we'll keep this meeting general in those terms. I'll go over the plan. I'll go over the network. Go over the member experience, what to expect down the road, and then we'll finish up with what I call our value-added programs, or for lack of a better word, the fun stuff, because obviously medical insurance is not really a fun, sexy product. So that's how we'll finish the meeting. So I'm not sure what documents have already been shared with you folks, but I am reading off of the benefit summary, and I'll just go through the plan. And
yeah, I shared the benefit summary with them, Craig. So everybody has a copy of that.
Perfect. So unfortunately or fortunately, our insurance industry is heavily laden with acronyms, abbreviations, and so forth. So I'll try to walk through as many as I possibly can. So the plan name looks very, very long. You don't have to memorize the plan name, but you folks are in a product called AFA, which is Aetna Funding Advantage. It's a trademark name. 1,000, 150, but most importantly, I wanted to focus first and foremost on the network. So CPOS2 is the name of the plan. CPOS2 also designates the network, and the network name is Choice POS2. So if you folks want to go in today, over the weekend, to see if your doctor, provider, pharmacy, whatnot, participates in the network, you can simply go to Aetna.com. You'll see a link to find a provider. You will click on, and again, it'll give you two options. You're going to click on an option, not a member now, because you folks won't be members until December 1st. And then simply you can go into the directory and look up providers by either using a zip code, your hometown, a county, or even the whole state. I don't recommend using the whole state because it'll take forever to download. And then you can go into that provider search engine and look for a provider. It will lead you to a drop-down box, and that's when you're going to click on your network. And again, it'll say Choice POS2 Open Access. It'll be under the Open Access selection of networks. Again, Choice POS2 is the network. Now that's today. On 12/1, when you folks are members, you'll then go into the member portal as a member. And when you click into finding a provider, only your network will populate. So that's the advantage of waiting until 12/1. But of course, I'm sure people want to know today where their doctors are in regards to the network. Okay, so this plan, is what we call a point of service, or a PPO plan. Simply means it's an open access product. You don't have to pick a primary care physician. You don't need referrals. And it does have an out-of-network component, which I'll get to in a few minutes. So the plan works very simply. There's a $1,000 deductible for a single, $2,000 deductible for a family, and a family is any combination of family members, you plus a spouse, you plus a child, or you plus a child and 3 spouses. That would be a family. There's no co-insurance plan, so outside of the deductible, the plan just goes into copays. So when you read through, now there is 2 documents. There's something called the Summary of Benefit Coverage, or SBC. To be completely transparent, it's not necessarily an Aetna document. It's a document that we were forced to use as a byproduct of the Affordable Care Act. I don't think it reads well, but make sure when you're reading the SBC, the deductible will be applied unless it explicitly notes deductible waived. So just keep that in mind. But very simply, when you go to your primary care physician, when you go to any specialist, and a specialist is anybody from a cardiologist to a dermatologist, there's no deductible. You're just paying a copay. So at the primary care level, the copay is $30, and at any specialist, the copay is $60. I'm not going to go, line item by line item, but I guess the question that people are probably asking is, well, when do I have to pay this $1,000 for myself? And I always use the term, well, think in terms of big ticket items. So anytime you are going for inpatient or outpatient surgeries, you'd have to pay your deductible first. Complex imaging, your MRIs, your CAT scans, your PET scans, you would pay that $1,000 deductible. There is no deductible at the pharmacy. So that's more news here on that plan. So that's, again, high level. Think of those financials: $1,000 deductible for a single. My out-of-pocket maximum is $4,000 for a single for the plan year, and then $30 at the PCP and $60 at the specialist. So those are the major financials on the plan. Out-of-network, there is an out-of-network benefit. And again, to be completely transparent, out-of-network is really more of a nice to have, but not necessarily a nice to use. And the reason being is because the industry, not just Aetna, but the industry over the course of the last 10 years has really moved away from out-of-network benefits. So it's really there for a catastrophic reason. All of our major hospitals are in this network, and this is our largest national network. So there's peace of mind in knowing, God forbid, you need to go into the city for hospital for special surgery, or Sloan Kettering, or bring a child to CHOP in Philly, or even get on a plane and travel to Cleveland Clinic or Mayo Clinic or Johns Hopkins. These are all in network. Out-of-network, those are typically your Park Avenue specialists that take no insurance at all. So don't think that this is a narrow network. It's not. It's actually our most robust. So out-of-network, it's there. I just recommend that people be very careful when using it, because the reimbursement levels are extremely low, and out-of-network providers can do something what's called balance billing. So just to do simple math, if their rate is $500 for a 30-minute consult, you have to pay the $500 up until your $2,000 out-of-network deductible. So you can see it can take numerous visits just to get to that level before you get into the co-insurance. So again, that's my spiel on out-of-network. I want to spend a couple minutes on the pharmacy component. Pharmacy work like this. We actually have 2 levels of generic drugs.
Craig, I think you have a question.
Oh, sure.
Did they have a question? Did somebody have a question for Craig? Okay, maybe I'm hearing things.
Okay, well, I do see some, most people are on mute, so if anyone has any questions, you have to unmute yourself. But either way, we'll get them answered now or at the end. So again, the pharmacy component, there's 2 levels of generic drugs. There's a $3 copay level, and there's a $10 copay level. The genesis of this program, very simply, when the Walmarts of the world and the big box retailers, your Costco's of the world, they were coming out with $10 generics, and then $7 and $5 and $3. So we matched what they were doing, and we are pretty close in matching what everyone else is doing when it comes to the generic copays. So again, there's 2 separate lists on the generics. Your next level is what we call a brand drug. The copay there is $45, The next level after that is what's called the non-formulary drug. Non-formulary drugs, the best way for me to explain a non-formulary, these are mostly the new to market drugs. They're more expensive. They're the ones that are spending all the money on the TV commercials. That's your non-formulary. That's a $75 copay. Then for those that are taking what's called specialty drugs, and specialty drugs normally would be anything self-injected, any infusions, and any oral specialty drugs. This excludes insulin. There's two levels of cost share on specialty drugs. The first level is a 20% copay up to a maximum of $250. And the most expensive of the specialty drugs would be a 40% cost share up to a maximum of $500. So just want to keep in mind that anything you spend, pharmacy, doctor, facility, all of this gets applied towards your out-of-pocket max. Okay. Switching gears now a little bit to people that are taking maintenance drugs. So a maintenance drug, obviously anything like a cholesterol medication, a blood pressure medication. We have some advantages here for folks that have to take medication on a regular basis. And
I'm sorry.
Sure.
Excuse me, I'm sorry, I didn't mean to interrupt. Does that include like inhalers for asthma?
Asthma inhalers would not fall under a maintenance drug.
Gotcha, okay.
So the beauty of the maintenance drug program is you have three options here into receiving your 90-day scripts. And when we talk about maintenance drug, we're talking specific to 90-day prescriptions. So you can fill your 90-day prescription and only have to pay 2 copays. So over the course of the year, I'm not really good at math, but over the course of the year, you would save 4 copays if you use the maintenance drug process that we have. So there are 3 options here. The first option is the mail order system. Some people love it, some people hate it, some people don't trust the Postal Service. That's personal choice. But the mail order system is through our partnership with CVS. And for those that don't know, CVS now owns Aetna. So you can use the CVS mail order system. You'll get your 90-day script, only pay 2 copays. Second option is to use any CVS retail location. You simply go to your local CVS, fill your 90-day script, still save your copay every quarter. There are still people out there that A, don't like mail order, or B, don't like CVS. They like their local mom and pop. They might like to go to Costco or whatnot. The third option is you can opt out of the previous 2 programs. So you won't use the mail order. You won't use the CVS retail location. You will actually physically opt out of that program. In order to opt out of that program, you will have to call the 800 number, member services, on the back of your ID card and request to opt out of that program. And then they'll allow you to go fill your 90-day script at any in-network Aetna pharmacy, but you will lose that save a copay every quarter. Okay, so just keep that in mind. Okay. All right. Anyone have any questions on how the plan works?
Yeah, sorry, Craig. My ability to focus for long is not that great. So on the CVS thing, if I order 90 days, but I pick it up at the pharmacy because I don't want to, wait for the post office, let's say, for example, is it the same cost as mail-in or not?
Generally, the mail order will have a different cost than the actual CVS retail location. And the reason being...
Okay, so 90 doesn't matter really per se, it's mail-in.
And again, you could always price it out before you decide whether to use the mail order system or a CVS retail location. And the reason being is because the mail order system is fixed with one cost, where CVS retail, just because it's, again, the nature of the business, the industry in which we operate, there could be 3 CVSs within a 5-mile radius of your home. And I can guarantee you each CVS will have a different reimbursement schedule for the same exact medication.
But Craig, that is only going to apply if the cost of the drug is less than the copay.
Absolutely. So you're just working with copays here. So the cost of which pharmacy should I go to really is not part of the equation.
It's only if the cost is less than the applicable copay, you would pay less than the copay.
Correct.
And sometimes the mail-ins are cheaper than going to the pharmacy, you know,
Correct.
in some cases. So the best thing to do probably, Kathleen, is just to kind of price it out and see, you know, so.
Yeah,
And again,
I have had to, I have on occasion bought one drug and it was actually less than my copay was. So.
correct. Yep.
Okay.
So just while we're on pharmacy, just edification, you know, you remember this meeting 2 months from now and you say, hey, that guy Craig from Aetna talked about, I have a $10 copay on some of my generics. That's the maximum you will pay. To Ray's point, that $10 generic, depending on the pharmacy, might be $2.17, and you'll only pay $2.17. So those copays are maximums. Okay. All right. Any other questions on the medical plan?
So before you move on, Craig, so you've all had a chance to look at what Joe Romano sent you regarding the benefits. And carefully looking at staying with AmeriHealth and moving to Aetna, I think what you'll see is that this plan design and being national and being open access and lower copays and lower maximum out of pockets, the benefits themselves are enhanced to what you were used to with the AmeriHealth plan. Okay, Craig.
Okay. All right. I'm going to stick to the CVS Aetna partnership. Another positive besides the mail order and the retail and the 90-day script and saving copays, another advantage of this new partnership is all of our members on this product can go to any CVS Minute Clinic at no cost. So I think last count, I think in the state of New Jersey, we're up to about 47 or so Minute Clinic locations. Works very simply. You can go to the CVS website, find a Minute Clinic, and you can go search to see what services they actually provide. I think the last count, there's actually literally 158 different line item services that are being performed at these Minute Clinics by medical professionals. So the way I would use a Minute Clinic, me personally speaking, you know, I think in terms of cost. So obviously a Minute Clinic is free for you folks on this plan. And obviously, you know, your PCP is a $30 copay, but what happens if your PCP says, well, my next appointment's in 5 days, or you're calling your PCP after hours and they're closed, or they're closed on weekends? Your next place that you would seek care would be an urgent care center. And on this particular plan, an urgent care is a $75 copay. So think in terms of what could I do at a CVS Minute Clinic for zero out of pocket? What would I use my PCP for care? If you folks can still hear me, bear with me. My computer just logged me out.
We see and hear you, Craig.
Okay, good. I just want to log back in so I don't lose my screen. Okay, here we go. Good, thanks. Okay, so going back to the Minute Clinics.
That is a frozen Craig.
It is the joys of this technology, I'm telling you.
It's good.
I just did a Zoom meeting though. We do a lot of Zooms on the sales side of it, and they pretty much go off without a hitch, I have to say.
Mm-hmm.
Okay. So these health hubs we're taking the Minute Clinic. Can you guys hear me?
We hear you, but you're frozen.
Oh, I'm frozen? Okay.
But we probably missed the first part of it. We just heard you start by saying health clubs.
Okay. Am I still frozen?
You are frozen, but we could hear you.
Okay, I'll keep talking. I'm sorry about that. The health hubs are the minute clinics, and just taken to the nth degree. So the minute clinics, again, are offering 158 services. A health hub adds in the addition of a health advocate. It has concierge level services. And most importantly, these health hubs are not carrier agnostic, meaning you don't have to be just an Aetna member to use these health hubs. They're open to folks that aren't even insured for enhanced services. So there'll always be more information on the health hubs coming down the pike. And I'm going to move over now to, and Ray, stop me, keep me in the right direction. I'm going to talk now more about the member experience, the evaluated programs that we have. So first and foremost, I implore everyone, and I will send marketing pieces over to Ray, and Ray will get it over to Joe in regards to the Aetna app as well as the member portal. So I recommend you folks using both, and I'll explain my reasons to that. The Aetna app, I'm hoping and assume that most people have smartphones. So I downloaded the Aetna app. The advantage of having the Aetna app is your ID card is on the homepage of the app. So you never have to worry about, is it in my wallet? Did I leave it at home? I don't have my ID card. I need that piece of plastic because doctors won't see you without it. As long as you have your phone, you have your ID card. The member portal is something that obviously you'd have on your home computer, because now it gives you the ability to obviously see a bigger screen, but more importantly, print things if you needed to print something. So both the member portal and the app will provide you with the same access. What you would use it for on a regular basis, again, this is what I use it for. You would use it to look up providers, because again, only your network would be pre-populated. Everyone knows that when they go to a doctor or a pharmacy, when a claim is submitted to the carrier, something called an explanation of benefits is automatically generated. You get that in the mail at your home, and it pretty much just says doctor's name, the date of service, what service they provided, and what your cost share was, if you paid them, and so forth. So your explanations are on there as well. But really, more importantly, all of the value-added programs that I'm going to touch on now are also in there. So that's why, we're not going to be sending out marketing material. I don't want to inundate you folks with too much information on the value add, because all these programs are embedded in the app and the portal. You can go in at your leisure and do your research, pull down the links, and read through all the offerings. So I'm going to go again at a high level as to the major programs that we offer on this AFA product. First and foremost, probably the most popular is something called Attain, A-T-T-A-I-N. Attain is a proprietary product that was created between Aetna and the Apple folks. And the Attain app works very simply. Well, first you need an Apple phone, which I don't have. I have an Android, but I can't use it. The Apple Watch works with the Attain app. And there's two components of the program. And this is all about us trying to keep folks engaged in health and kind of make it fun. We kind of looked at the Fitbit and just put it on steroids, because the Fitbit obviously was at the infancy of what we've created here with the Attain app. So the Attain app is offered to you as the enrolled employee, as well as your enrolled spouse, if any, and any of your adult 18 and over dependent enrolled children. They download the app, and the app will create a profile. You fill out some information, and how the app works is we will take your health and fitness goals and your activity and download that into the app. But also the app will also talk to our claim system. So what does that really mean? Well, it's all point structure. You're given a daily goal, a weekly goal, a monthly goal. When you reach your monthly goal on the app, we will pay for your Apple Watch for that month. And I'll explain that in more depth in a second. The claims part of it is, well, our claim system will be able to tell us if Craig DeRosa got his preventive physical this year. I get points for that. If Craig's taking cholesterol medication, every time I fill my script, I get points. If I get my flu shot, I get points. If I get various inoculations based on my age and gender, I get points. So this whole point structure adds to your monthly goal, and we will pay for the watch. So the whole paying of the watch, how does this work? Very simply, there's a transaction between us as the insurance carrier through Apple. So it's not necessarily just Aetna, it's Apple and Aetna. There's a 24-month lease program on the watch between us and you as the member. You'll give us credit card information, and again, it's a 24-month lease. I'm sorry, it's not really a lease, it's a 24-month option. Did you actually own it? So every month, again, you have the ability to earn points where we pay for the watch that month. And there are, of course, months where maybe you got hurt and couldn't get off the couch and you didn't hit your goals that month. You would owe the Attain program money on a monthly basis. So I'm not an Apple person. I think the base level Apple product is the level 3. I think it runs about $12.47 a month over the course of 24 months. So the second question is, well, Craig, this sounds great. I already have an Apple Watch. What's in it for me? You can still use the Attain app, still attain your monthly goals. And rather than us, of course, pay for your watch, which you already own, you can convert those points into gift cards. Gift cards like you see in every other, anything from a restaurant to the movie theater to merchandise at a myriad of stores. So that's probably our most popular evaluated member program that we're offering right now. The next program is something called PeerFit. I know a lot of folks always ask, well, what's the gym reimbursement? And this plan doesn't have gym reimbursements, but instead we have this program called PeerFit. PeerFit also works very simply, except the PeerFit program is only for the enrolled employee, not your dependents. And PeerFit is really, I look at PeerFit really as an ancillary fitness program to whatever you're doing today. So if you belong to a gym membership, obviously you need to keep your gym membership, because the PeerFit program contracts with various health club facilities in the area. Anything from a health club, boxing studio, yoga studio, CrossFit studio. You get points there as well. And those points equate, depending on the facility, on average to 4 free classes a month. So it's really a supplement to what you're doing today. And that's the PeerFit program. And again, there'll be more information on the PeerFit embedded in the member portal and the app. The next one I wanted to talk about was, because I think it's important with obviously what we're dealing with here with COVID for the last 8 months and so, is folks' mental health. There's an embedded employee assistance program in this product. We just trademarked it as Resources for Living. So you might get a postcard in the mail at some point from Aetna explaining the service. This is an enhanced employee assistance program. This is something we actually sell as at an additional cost to groups much larger than yours. So this is a true enhanced EAP program. The program works like this. There are pretty much 4 tiers of assistance: 1 legal, 1 financial, 1 mental health, and the last one is just really family resources. Plenty of folks are taking care of maybe elderly adult parents and so forth. So the beauty of the EAP program is you have unlimited telephonic visits on any of those 4 core resources within EAP. You also get 3 free face-to-face with a mental health professional during the course of the year. The third thing that I like about it is any adult living in your home, regardless if they are insured by Aetna, has access to the program. So it's really a fantastic, I think, evaluated program to be able to offer to you folks, especially during these uncertain times. So again, above and beyond that, we still have Jenny Craig Weight Watcher discounts embedded in our value add, vision discounts through iMed and Aetna. So when you take the iMed and Aetna networks on the vision side, we've created the largest network in the country. The medical plan, you have embedded in the medical plan one free eye exam a year on the medical plan. It is a simple refractory, so anything above and beyond a simple refractory exam would be an extra charge. But once you have your free exam, you can then, of course, use the evaluated vision discount program, and that's unlimited. So if you're buying glasses for your 8-year-old and a week later they break them, well, go get another pair and you get the same discount. Okay. Any questions on that? I know I was talking a mile a minute. Okay. So the question I want to ask next is, okay, Craig, this sounds great. When do I get my ID cards? So as soon as you folks are installed in our system, I will be able to get a list of your member IDs generated. I will get them over to Ray. With your member ID, you'll be able to download your Aetna app and create your own user ID and password. And with the member ID, you can also go into the member portal and create your own user ID and password there as well. Using the member portal will give you the ability to print a temporary ID card. And of course, with the app, your ID card is already on your phone. We only send plastic ID cards to you as the enrolled employee, and we only send cards to your enrolled spouse. If anyone has an adult child, when I say adult, age 18 and over, that is attending maybe college out of state, if they need a card, we can order one for you. It's as simple as calling the 800 number, member services on the back of your ID card, and we'll get cards out to those dependent kids. So Ray, did I miss anything else you wanted me to focus on? Anything you want me to reiterate?
No, I think that's everything that I thought you should go over, the benefits, the details of them, and then the value add programs. Because we know when you have health insurance, some people utilize the actual benefits more than others. But as you can see that being in the program, you have other additional benefits that you could take advantage of without necessarily using it for sick visits. So I'm glad we're good with that. Does anybody have any questions for Craig?
Eventually, someday, far in the future, I will be back on the road and traveling, via plane, etc. So I'm assuming for most major areas of this country, since I won't be based in my home base, that Aetna has a pretty decent, robust plan throughout the country, correct?
That is correct. So like I mentioned earlier, this is our largest national network. This is the same network that we sell to our 50,000 employer life groups. There's even network here in Hawaii and Alaska. I'm not sure where you travel, but yeah, rest assured, again, when you're traveling, emergency is always an emergency. Don't stop to think when there's a true emergency. But if you're traveling and you think you're coming down with a cold, again, urgent care, Minute Clinic, pull up your app. It'll tell you the nearest one, or simply call the 800 number in the back of their ID. They will make sure you stay within the network in that regard.
Perfect. Thank you.
Joe Romano, is there anything else you want to be covered? He's not muted.
He's having problems with the microphone.
Okay. Is there any other questions before we wrap up today's call? Sorry.
I have a question. Oh my gosh, it's echoing so bad. Craig, I might need to connect with you. I have questions about Aetna Network doctors for my son's autism.
Okay.
And I had another question, but it went out of my head.
Well, I suggest if whether you think about it over the weekend, next week, or next month, just you email Ray, and Ray will flip it over to me, and we'll get it answered for you.
Thank you.
Okay?
Okay.
Craig, there was a question in the question box, national versus international coverage.
Good question, because that just came up last week. So all of our commercial products, you're only covered out of the country during a true emergency. So if you're traveling, peace of mind is important. You can always buy a supplemental travel health insurance policy. But other than that, keep in mind, true emergencies only. You can get a boo-boo and go to the hospital, and we're not going to cover that. It has to be a true emergency. So again, peace of mind is important. I just recommend a travel health insurance policy for that trip.
Let me see, there's more questions here. Joe says his mic is not working. Okay.
Oh, I see it. Yep.
All right, so I don't see any other questions. If that's the case, I think we're going to end today's call. Obviously, you always have access to me in my office, as well as your account manager, Joe Genova. So we're here for you. And Joe says, thank you, Joe Romano. So with that, have a great weekend. Everybody have a happy Thanksgiving.
Thanks, everyone.